Let's move on to discuss some of the things that we do after the birth of a baby as normal standard of care. One of the first things we give baby when they are nice and stable is a shot of vitamin K. Vitamin K helps promote clotting, reducing the risk of bleeding. In the body, the liver is what normally produces clotting factors and prevents unhealthy bleeding. But in newborns, it can take a couple of days for their livers to get up and running all the way. Vitamin K shots are a way to help bridge this gap and prevent dangerous bleeds from occurring. Although this can apply just to small bleeds like umbilical cord bleeds or the bleeding associated with circumcision, it can also apply to bleeds inside the brain, which occurs in over half of babies that bleed due to vitamin K deficiency. The risk of bleeding can be around 1 to 2%, which may seem like a low risk for people who like to gamble with their lives. But in the practice of medicine, that level of risk is unacceptably high for something that is easily preventable. Another one of the first things given to babies is erythromycin eye ointment, which prevents something called gonococcal ophthalmia neonatorum, or an infection of the eyes caused by gonorrhea that can lead to scarring and blindness, with transmission rates of 30 to 50% from infected mothers to babies who are not treated. The infection is rapidly progressive, which is part of why treatment is given at birth. While there are some national level discussions about whether or not universal preventive treatment should be given, as the incidence of the disease is quite low now due to prenatal screening, it is still currently recommended for everyone due to the severe consequences associated with infection. After these treatments, the standard of care for newborns is to get several screenings before they leave the hospital. This includes a hearing screen to ensure there are no hearing problems, a pulse oximetry screen that assesses blood oxygenation in the upper and lower body, and a newborn metabolic screen that tests for rare genetic conditions. As I mentioned earlier, the liver in newborns is still getting up to speed, so we also monitor bilirubin levels, which are normally processed by the liver. If bilirubin levels get too high, they can cause jaundice or yellowing of the skin. A little bit of this is normal, but if they get too high, they can risk causing brain damage, so phototherapy or shining bright blue lights on baby skin to break up the bilirubin may be necessary. We also administer the hepatitis B vaccine at birth. Hepatitis B is a liver infection, and 90% of newborns who are infected at birth will develop chronic infection, and about 1 in 4 of those with chronic infection will eventually end up dying from liver cancer or cirrhosis later in life. Newborns are much more susceptible to this disease, as in adults, exposure leads to chronic infection in only about 5 to 10% of cases, rather than 90% in newborns, which is one reason why we administer it so early. For mothers with active hepatitis B infection at delivery, antibodies will also be given to the newborn at birth as well to help prevent chronic infection. There are actually some really amazing graphs out there to look at, showing how the rates of hepatitis B fell drastically first after the vaccine was developed, then after screening and pregnancy was recommended, and then even more when newborn vaccination was recommended, with really fantastic results. Another shot you may have heard about before is RSV. RSV is a respiratory virus, or a virus that infects the lungs. It is particularly dangerous for newborns. For women who receive the RSV vaccine during pregnancy, their antibodies will transfer over to the baby, so no shot is recommended for the baby. However, if the mother did not receive the RSV vaccine, then a shot of anti-RSV antibodies may be recommended for the baby to provide them with protection after birth. RSV is particularly prevalent during the winter season, so immunization may not be recommended for children born during the summer. Newborns account for about 20% of all RSV-related deaths in the first 6 months of life, so they are particularly susceptible. Having worked in a pediatric emergency room, RSV is very common, with studies showing about 2 to 3% of infants hospitalized with RSV in the first year of life. I sometimes have curious parents ask about what I'm checking for when I do a newborn physical exam, so here's a quick breakdown. I check the soft spots to see if there's concerning swelling indicating pressure inside the skull, or to see if there's a developmental abnormality. I check the eyes for the red reflex to make sure there aren't any cataracts or tumors. I check the mouth to make sure there is a good suck reflex and no oral abnormalities. I check the collarbone for fractures. I check the Moro or fall reflex to make sure there aren't nerve injuries affecting the arms. I check for concerning lung sounds or other abnormalities like a pneumothorax or a collapsed lung. I check the heart for murmurs. I check the grip reflex and muscle tone. I check the belly for tumors or abnormal liver or spleen size. I check the belly for umbilical hernias or cord problems. I check the hips for developmental problems of the hip sockets. I check the genitals to make sure everything is formed correctly and to make sure that I can find the testicles, as sometimes these are hiding up higher, and if they don't descend, that could signal a variety of different problems. I check the anus to make sure that there is a hole there, because sometimes the hole is not properly formed. I check the bottoms of the feet for symmetric reflexes. I check the back and the butt for any problematic dimples or sacral abnormalities that can signal spinal cord problems. I check spinal muscle tone because a genetic condition called spinal muscle atrophy can occur. I check the numbers of fingers and toes, and I check the general appearance for things like rash, behavior, and oxygenation. This exam is repeated multiple times because some changes over time are to be expected, and for this reason, it isn't out of the question for the outpatient pediatrician to notice something that wasn't remarked on by the pediatrician taking care of the newborns in the hospital either. Other general education that we provide to all parents include proper umbilical cord care, which involves things like keeping the cord nice and dry and folding down diapers so it doesn't get stuck inside, get wet, and increase the risk of infection. A healthy dry cord should fall off within a couple of weeks normally. Also, some cultures have a practice where they may put a coin on the end of the umbilical cord, especially with a home birth, and please never do that, because that's a buzzword on medical school exams for giving tetanus to a newborn. We also always talk about safe sleep, which means putting baby to sleep in their own bassinet, not sleeping with parents, putting them to sleep on their back, and wrapping them up nice and tight without any other blankets or pillows or stuffed animals that might suffocate them nearby. Don't fall asleep with baby, as they can slide off and get suffocated by pillows and blankets, or they can fall off the bed and get hurt. We also talk about signs and symptoms of infection, because even late infection can occur, especially in mothers positive for GBS or Group B strep, even if they were treated. These symptoms can include lethargy, refusing to eat, fussiness, color changes like getting really pale, breathing difficulties, and any temperature of 100.4 or higher via rectal thermometer, which is never normal in a newborn and merits a trip to the emergency room. Finally, just for funsies, here is a non-comprehensive list on why it is a terrible idea to do a home birth, but just for babies this time. Maybe I'll talk about why it's bad for mothers too another time. It turns out the doctors do a ton of things to take care of babies, and just because someone doesn't know what those things are, isn't able to understand the risk, or has poor judgment, it doesn't mean that those things won't still hurt or kill their baby all the same. So, in no particular order, baby can be born with a cord wrapped around their neck, which if not reduced by someone properly trained can kill them. Baby can be delivering with umbilical cord prolapse, meaning part of the cord coming out first, which typically needs to be converted to an emergency C-section in order to save baby's life. Baby can have a shoulder dystocia, meaning their shoulder can get stuck coming out, which can lead to permanent nerve injury or death if not managed appropriately. Baby can aspirate meconium, meaning inhale their pre-birth poop into their lungs before coming out, preventing them from opening their lungs enough without deep suction and causing respiratory failure. Baby can have acute respiratory distress syndrome due to immature lungs and require medicine or oxygen support in order to survive. Baby can get sepsis due to mama being GBS positive and not getting adequate antibiotics during birth, leading to death. Baby can get an infection due to prolonged rupture of membranes, leading to serious illness or death. Baby can get kernicterus and brain damage due to jaundice levels getting too high. Baby can have a potentially fatal bleed in the brain due to not getting a vitamin K shot. Baby can go blind due to not getting erythromycin eye ointment. Serious heart, hearing, or metabolic disease can be missed due to missing newborn screens that can lead to disability or death if baby has poor medical follow-up. Baby can get congenital hepatitis B and die from liver failure or liver cancer due to mom not being screened or missing vaccinations. Baby can get tetanus due to bad umbilical cord care. Baby can die from low blood sugar without proper monitoring and nutritional intervention. Breastfeeding can fail to establish without integrated lactation support. Baby can suffer from blood type mismatches that won't be caught, leading to serious blood breakdown and rapidly increasing jaundice. Baby can suffer brain and tissue damage due to low oxygen levels not caught without running umbilical cord blood gases. Baby can get RSV and get hospitalized or die without immunization. All of the physical exam findings I mentioned can be missed, including cataracts, eye tumors, hip development issues, spinal muscle atrophy, heart murmurs, and more, especially if follow-up with a pediatrician is poor. And numerous congenital infections can be missed and treatment delayed, leading to death or lifelong disability. That's just some stream of consciousness, and by no means a comprehensive list. But rest assured that medically speaking, home births are a very bad idea for baby, and yes, there are many ways that it is a bad idea for mothers too. Alright everyone, here is the final result. Let me know your thoughts down in the comments below. I probably stepped on several more toes with some of my commentary on this one, but I'm fine with that, because prenatal and newborn care is extremely important. Overall, I am not that satisfied with the final result, unfortunately. The effect of the optical illusion isn't very strong, not as strong as I hoped it would be, and I just don't like the overall results as much in general, but that's okay. You win some, you lose some. I'll probably be taking a bit of a break from content for a while now, as my past several projects really haven't had much engagement or interest at all, and although growth or popularity aren't really the primary motivating factors for me, if nobody watches, then that means my public health messaging isn't engaging enough and therefore is not reaching anyone, and promoting public health is the primary motivating factor for me, so I'll have to take a step back and reconsider my approach. By the time you watch this, I'll also be on a multiple month stretch of busy inpatient medicine services anyway, so I won't really have time or energy to be making content, even if it was taking off. Anyway, hope you enjoyed, and if you did, please consider liking, subscribing, sharing, or commenting down below to let me know. Ciao.